Welcome family members, friends, university faculty, and staff. Welcome everyone who has made this event possible. This program will be in English. However, I will say a few words in Spanish for our monolingual guests. Bienvenidos, clase de primavera del 2021. Bienvenido familiares, amigos, docencia y empleados. Bienvenido todos quienes han hecho posible este evento. Este programa será mayormente en inglés, así es que por favor disfruten y daremos instrucciones al final para recordarles que se reúnan con nosotros virtualmente para socializar. Vamos a tener en el chat, podrán ver algunas traducciones para nuestros discursantes del día de hoy. Voy a hablar un poco acerca del programa ahora. I am so thankful for this moment and all the efforts that everyone put into this semester. Remember that the first time that you joined classes and then you felt doubtful. So those moments are gone and now you're here graduating and this is just the beginning. Recuerden que cómo se sintieron cuando se reunieron por primera vez en clase, que tal vez tuvieron alguna duda. Ahora estamos aquí reunidos y vamos a empezar, y esto solamente es el comienzo. After I introduce our team, we will have the opening remarks by Dr. Price. One of our students, Yvonne Hill, will introduce our special speaker today, Congresswoman Sheila Jackson-Lee. Right after, we'll have the presentation of certificates, and we'll have the Network CHW Trust Alliance Red Promotores de Salud welcoming the new members, and then our program will adjourn. Vamos a tener este programa y estas son las listas de quienes van a hablar. Después de que yo presente al Dr. Price, vamos a tener a uno de nuestros estudiantes de Bonten Hill, quien va a presentar a quien les va a hablar el día de hoy, la congresista Sheila Jackson-Lee. Después vamos a tener los certificados y la presentación y bienvenida para el network y la red para ustedes como graduados del programa de promotores de salud. Y después nuestro programa finalizará. Now I'm going to introduce our team. And we have Miss Cindy Paz, who's the instructor for the certification class in English. So I guess the class in Spanish, not all of them, they know her. And also we have Mr. Andrew Kapler, who is the program director for Data and Science Institute. And of course, many of you know Ms. Alba Cepeda, who is our affiliated instructor now, and one of the best teaching assistants I ever met. I'm Donna, and I'm the director of this training center, and now I'm going to introduce Dr. Price. Dr. Price, who is the mastermind and founder of the CHW initiative, and who has put us together to meet people so wonderful and who are graduating today. Ahora voy a dejar que el Dr. Price nos dé unas palabras de bienvenida, y él es el que ha ocasionado todo esto y el fundador de la iniciativa de promotores de salud y quien ha hecho posible que nosotros estemos aquí reunidos y que hayamos conocido a gente tan especial como ustedes que se gradúan hoy, el día de hoy. Dr. Price.
Thank you, Donna. Good morning, everyone. Buenos días a todos y gracias a la doctora Stelzig. None of this would have been possible without the work she has done as the director of the training program and her work as the Spanish language instructor at the community family centers over the last 2 years. It's just been incredible. Equally, Cindy Paz has done incredible work as the instructor for the English language classes online this whole last year. When I think about our program, I am in awe of the work that each of them has done and the work that we have ready to go as we've fully emerged from the pandemic. Whenever I try to draw an org chart, an organizational chart, I realize that each of them fulfills at least 3 roles and that I would be hard pressed to replace either of them, even with 3 or 4 ordinary people. They go way beyond the job descriptions, creativity, heart, and dedication that I personally find inspiring. There's just no way that I could sleep in on a weekend knowing that they're always working and always doing so much. As I was preparing my remarks this morning, I began to realize how many people I depended on to keep the Community Health Worker Initiative going. I have a few remarks about the program, but I would be deeply remiss not to express my personal thanks to some of the folks who do so much for us all. Thankfully, as I'm giving my thanks to them, you will see some of the projects that were coming up and that I'm so proud of. I'd like to thank soon-to-be Dr. Andrew Capperell, the Director of Engaged Data Science at the Hewlett-Packard Enterprise Data Science Institute. He's an amazingly smart and efficient partner who manages to support all our work with students and communities with humor and wisdom. He has been especially important in supporting our Peers program, where UH undergraduates help HISD students through a project-based, community health curriculum and a contest. It's expanding throughout HISD and originated in a CHW class that Dr. Stelzig and I taught in the 5th Ward just 3 years ago. It's a great example of what it means for your projects to become reality. We've also been extraordinarily lucky to have support from Dr. Yannis Konstantinidis, who splits his time with the Data Science Institute, but whose intelligence and wit makes a real difference in all our projects. I'd like to thank Dr. Claudia Newhauser, Associate Vice President and Associate Vice Chancellor for Research and Technology, transfer at the University of Houston. Her support has been invaluable, as has Dr. David Francis and Michelle Hoffman and Bertha Gill, Helen Lozano, and Men Zhuang at the Texas Institute for Measurement, Evaluation, and Statistics. Data, measurement, and statistics is the backbone of all we're doing. I'd like to welcome Dr. Ariel Ludwig, who will be joining the team starting in June and who works on issues around criminal justice. She's already forming new connections with community organizations and opening up whole new avenues for work by the community health workers and students at UH. And the presentation I just saw by Devonte Hill and his team about 5th Ward and recent reentry by people that have been involved in criminal justice will work tremendously well with her area of specialization. I do like to thank the College of Medicine. I get personal support from Dean Stephen Spann and Dr. David Buck, and we share a deep commitment to improving community health. The Humana Institute at the College of Medicine, under the leadership of Dr. LaChauncey Woodard, helped support our undergraduate research initiatives, and Humana provided the initial support for the development of the business model around care coordination by CHWs. That's the business model that's so important, and I'll talk about it just a little bit as we're going later. I'm also looking forward to new projects with Dr. Bettina Beach and Dr. Jerome Crowder from the College of Medicine, and with a team from the Baylor College of Medicine led by Dr. Ashok Balasubramanianam on rare type diabetes and expanded roles for CHWs in scientific research. We also get student support and important collaboration on our projects from the Graduate College of Social Work and Dr. Sarah Narendorf. She introduced us to pathways for our work with graduates of the foster care system here in Houston, as they introduce new ways to provide peer support for young people facing housing and employment challenges through Kelly Opot at the Harris County Health Collective and Allie Jacobs, also at the Graduate College of Social Work. I'd also like to thank Jasmine Harris for her technical support during this presentation. Finally, in terms of the University of Houston team, I'd like to say a deep personal thanks to the Dean of the Honors College at the University of Houston, Dr. Bill Monroe. He has been the essential silent partner throughout my career, but especially over the last 10 years, as the projects in data science and community health first took shape and then took form as the Community Health Worker Initiative as we now know it. He has been deeply supportive of that developing vision and willing to trust the overall vision as it emerges. I'd also like to express my sincere gratitude to some of the community partners we're working with that I haven't yet mentioned, and use that as a way to talk further about what projects we have coming up, because I'm tremendously proud of them, and I would like you to all know about at least part of them. First, the Community Family Centers, under the incredible leadership of Maritza Guerrero, has proven to be a transformational partner for the Community Health Worker Initiative. Donna Stelzig had started by teaching a CHW class there a year ago, with a special thanks to Paul Landa and Dr. Frecia Todd, and it remains the core and heart of our work with CFC to offer these classes. There is a group of students graduating from the Community Family Centers who receive their scholarships through the Adult Education Literacy Funds provided by the Houston Galveston Area Council, and we thank them for that support. It's essential to keep things going. A new grant from Blue Cross Blue Shield's Healthy Kids, Healthy Families initiative has allowed us to begin work with community health workers in 3 different HISD schools. Miguel de Luna and Rosalba Castillo set up the original project, and we've had exceptional work from Marcelis Perez, Melissa Farias, Carlos Gropa, Angelica Gonzalez Melo, Marcia Morales, and Rosalia de la Torre. Also at CFC, a grant originating with Dr. Marcia Ori and Dr. Nipa Pena Purcell at the Center for Population Health and Aging at Texas A&M University has allowed the CHWs to lead a diabetes education program called Your Diabetes, Your Heart. CHWs there have also provided essential aid in distributing emergency funds from Harris County, and this has been especially important as we develop that care coordination and health education platform that will, I believe, prove absolutely transformative for how we understand the capacity of CHWs to work in their community. Our other main partner in developing the care coordination work started working with us only a year ago, but we're moving at 1,000 miles an hour. That is Bread of Life. Under the inspirational leader, Pastor Rudy Rasmus, and the new executive director, Johnny Jones, J Square, with help from Claire Smith. They saw clearly the potential of the embedded CHW model and the idea that leading all our outreach with the strong message that we are primarily health advocates for each individual, and understanding that only in that way can we build the trust with the broader community to make successful health outreach really work. They were approached by the Rockefeller Foundation to help with a nationwide outreach effort to increase vaccination rates among vulnerable populations, with a strong emphasis on addressing health disparities more broadly. That model has proven very convincing to those funders and others, and we will have the opportunity to expand into new partnerships with others, including one of last year's CHW graduates, Jessica Somerville's project with the United Methodist Church, with Elia Chino's Fundación Latino de Acción Social, with Madeline Traylor at Power for Life, and Father Ed Gonzalez at St. Paul's Catholic Church. It has also given us a model that the City of Houston Health Department is supporting through a grant that should be announced in a few days and will allow us to yet further expand our CHW work and presence throughout the city. It allowed us to work with Congresswoman Sheila Jackson Lee's office in vaccination projects in the 5th Ward, and we're extremely proud of all of that work and hope that it continues on into the future. And we thank her for her support and her presence today. I'd also like to thank Kalal Mahata at the Patient Care Intervention Center, who along with his exceptional data science team provides the data platform that will make that care coordination work as a business model broader than just a single nonprofit organization could ever support. I'd also like to thank some of the folks working with us on developing new educational outreach programs. Dr. Kenya Ford, who is also graduating as a community health worker today, teaches at Prairie View University and will be working with us and Dr. Angela Mashak at Texas Southern University on cancer prevention research and prevention programs. Larissa Jacobs and Veronica Sanchez at the American Heart Association are working with us to develop new outreach and training around heart health. Concepcion Miranda at the Houston Area Women's Center worked with us on a Spanish language education outreach for interpersonal violence. And Rachel Walker and Hill Olson at the Immunization Partnership are working with us to create education around all vaccinations, not just the COVID vaccines. Finally, I'd like to thank Dr. Dorothy Mandel from the University of Texas Health Science Center at Tyler and the director, among many other things, of Texas Safe Babies. She has been working with us to develop a major new thrust of our work called Strong Brains. It is teaching and support for community understanding and implementation of best practices to support the development of pediatric neurological health. That work could be incorporated in lots of different directions and could be a real backbone for our outreach to young families. Alba Zapita and Christy McCool worked on these translations and so many other things. Deborah Zola has also worked on both this project and on helping in the CHW class and working with Tia McGee on Imagine My Life, a women's support group at CUNY Homes. And Michelle Miner and Kenneth Horn have been doing new work out of New Hope Housing, but working in the broader Sunnyside area on this care coordination, and I'd like to thank them. Perhaps most importantly, although also brand new, we have the incredible work from our team on the new Trust Alliance, whom you'll hear from later, including Michelle Miner and Jorge Flores. There are so many that I need to thank. I just want to say that they've been working in great directions, and it's just been inspiring to see so many people come together in so many ways. I'd like to say just one quick thing before introducing Devontae Hill, and that is, it's really important to understand why project-based learning is so essential to understanding strengths-based work. We want to approach communities and all the individuals in the communities and all of our students in terms of their strengths and not their deficits. Project-based learning first and most importantly, rewards people for working together and working towards larger goals. So much of the broken trust we have in our broader society comes from the sense that the world is a competition. A dog-eat-dog world where there is only one winner and everyone else is a loser. We should see that way too much of our educational system embraces this dangerous message in both implicit and explicit ways. In project-based learning, both the implicit and explicit message is that there is something larger than just the self. There's something larger and more important than your opinion about something, no matter how well educated that opinion is. That something larger is what you'd like to see get done. It's the projects in your life. That makes it very much about a strengths-based approach. For every student, we want to meet people where they are and see what strengths they have that haven't been allowed to emerge yet. We don't provide new strengths, but opportunities for those strengths to flourish through gaining clarity, through encouraging that sense of mission in their lives and embracing the idea that big ideas belong to the community, not just to the experts. This is, we believe, the key to all sorts of preventative health endeavors, and where we have a unique and better approach to creating the messaging that will actually lead to better health behaviors. When people see themselves as the origin and strength behind their own health, and when the CHWs support that sense of strength, they will get much better health outcomes than the dominant messaging that happens now from the healthcare system, which implicitly and explicitly tells people that they don't know anything about even their own health, that they have to be measured by an expert to know anything about their own body, and that they are dependent on experts in order to know anything, and that they should just be quiet and comply with the recommendations from the experts. Now, it's not about whether you believe that the experts are right or wrong. It's that you see that the projects we are engaged in our lives, are bigger than just opinions. The good health is part of the trajectory of our lives and not an opinion. It allows people to do things like address chronic illness and long-term health as a continual process and not just an isolated opinion about whether or not someone should go on a diet. That this is also about community strengths and what it means to have empowered and embedded CHWs providing the leadership and meaningful and grounded work is the final clue. Because that's where we go out into communities and say, it's not about the university having better answers. It's about the university being able to respond to the community strengths to help CHWs and others in the community learn how to be heard, learn how to have a more effective voice, learn how to put those projects into action. And it's a new role for the university, but it's a better role. And it's a role that can mean that the communities have their strengths in place and flourishing, as opposed to being told, oh, well, you're somehow weak, you're somehow a deficit community, and we're going to help you out of charity. No, it's about the projects coming together, people working together for a better overall world. The final piece is that that's a business model, because we can have better health outcomes by framing all of our interactions in terms of strengths. And when we have better health outcomes, the healthcare system gets better results. And those results are valuable. And there's a business model there. There are ways in which we can close that loop and create value for the broader community. With that, thanks for your patience going through that. I know it's a lot, but it's, I think, transformational in its possibilities. I'd like to turn to Devonte Hill. He's going to provide the introduction to our inspiring special guest, Congresswoman Sheila Jackson-Lee. He himself is an inspiring young man. I just heard his talk on a Fifth Ward Men's Health and Reentry project that he'd like to lead. He has a moving personal story that it's a little too long to go into, but he's got lots of good reasons for understanding why a reentry project in a place like the Fifth Ward is important and could be transformative for the lives of so many. Devonte, please take over and introduce Congresswoman Sheila Jackson-Lee.
Thank you, Dr. Price, for that introduction. I'll be presenting our next speaker, which is Congresswoman Sheila Jackson-Lee. Congresswoman Sheila Jackson-Lee is an influential and forceful voice in Washington. She is a senior member of the Chief Deputy Whip of the United States Representatives. She represents the 18th Congressional District of Texas, situated in Houston, which is the energy capital of the world. The Congresswoman has been called one of the hardest working members in Congress. She has worked tirelessly to bring billions of dollars to project homes and families from flooding. She is dedicated to upholding the constitutional rights of all people. Congresswoman Jackson Lee is a senior member of the House Committee and on the Judiciary, where she serves on the Subcommittee on Crime, Terrorism, and Homeland Security and Immigration and Citizenship. She is the chairwoman of the Crime, Terrorism, and Homeland Security Subcommittee, which established her as one of the key policymakers on Homeland Security matters. In addition, the Congresswoman is a senior member of the Committee on Homeland Security, where she serves on the cybersecurity, infrastructure, protection, and innovation. Also, the Congresswoman is a senior member of the Budget Committee. During her tenure in Congress, Congresswoman Jackson Lee has served as a member of the Congressional Human Rights Caucus, the Congressional Caucus on Women's Issues, the Congressional Black Caucus, and the Aeronautics and Space Caucus, the House Democratic Caucus Task Force on Hunger, and the Congressional Black Caucus Foundation Board of Directors, Welfare, Reform, House Internet Caucus, and Economic Renewal, Affirmative Action and Travel and Terrorism. In addition, she is the founder and chairperson of the Congressional Children's Caucus. This caucus continues to advocate on behalf of children nationwide. And before her election to Congress, she served 2 terms as one of the first African female at-large members of the Houston City Council. Prior to her council service, she was an associate municipal court judge for the city of Houston. Congresswoman Jackson Lee received her undergraduate degree from Yale University, graduating from the honors program in political science. She went on to receive her Juris Doctorate from the University of Virginia School of Law. And she's also a proud member of Alpha Kappa Alpha Sorority Inc., the Lynx Inc. The Congresswoman Jackson Lee is a proud wife, mother of 2, and grandmother of 2 twin grandchildren. And without further ado, I'd like to present the Congresswoman Sheila Jackson Lee.
How exciting it is to be with you this morning and to have the opportunity to congratulate the University of Houston College community health workers, and to be able to offer to you this morning a reflection that I thought of as I was honored to receive this invitation and to have the opportunity to speak with you today. I thought of why we can't wait. Why we can't wait for you, community health workers. Why Houston, why Texas, why the nation cannot wait for you. We cannot wait because you are the light at the end of the tunnel. To all of your families and friends that have gathered, they are in fact the new face of healthcare in America. We know the challenges of healthcare, no matter how hard those who are in this profession work. There has become a certain mistrust and fear, generated not by any truth, but by the conditions, the atmosphere, the circumstances of COVID-19 that none of us ever confronted in this present lifetime. And so community health workers, they were on the front lines, joining our nurses and doctors and our other health professionals, but they were on the front line making eye contact and ensuring that all might be well. I want to give you an example of a community health worker, Cheryl Garfield, who in the midst of this terrible epidemic and pandemic in West Philadelphia, she was a navigator of pandemic loss and hardship. She called on people who were isolated in their homes, people who were sick and afraid, people who could not afford their rent and couldn't get an appointment with a doctor. Just take us back on a memory lane. Just take us back to the beginning of 2020, right after 2019, when there were signs that something was awry. Just take us back, and there was massive confusion in the early part of January. Sorry to say, no strong voice coming from the White House. So we were on our own, and people were trying to find out what was this, as certain cities were falling victim, like New York, Detroit, and New Orleans. People over and over again in the pandemic were getting sick, were getting hospitalized, and we can see the visuals on the television, not having enough oxygen, and yes, passing away. But a bright light of community health workers, and those of you at the University of Houston community health workers were on the rise. You work with the city of Houston to develop the community health education fellows, but you were their partner. And you went into neighborhoods like Third Ward, the East End, Sunnyside. You were unafraid. You educated people. You tapped into people. You understood why we cannot wait. And so as you begin your journey, I want you to understand some of the words of a really old age philosopher. Cicero said, "In nothing do men more nearly approach men and women, the gods, than in giving health to men and women." That is true. When someone is desperate and unhealthy, how important it is to have those of you who understand comfort, healing, choices that people have to make. In this whole world of healthcare, we know that minorities confront this in a more difficult way. For example, African Americans, the leading causes of death among African Americans include heart disease, cancer, and accidents. But in this year pandemic, that became the highest cause of death. At the same time, the leading cause of death for Hispanics are in fact challenging as well. They are in fact responding to cancer, heart disease, and accidents. Infant mortality rates are high among certain Hispanics, and infant mortality rates are extremely high as it relates to African Americans. Other minority groups suffer in their own way. For example, violence and gun violence have been declared a health issue for the Centers for Disease Control. And what we're seeing in Asian hate is a sickness. And because of the injuries and tragically sometimes death, you might not imagine that community health workers could be involved. We should all stand against the scourge of hatred. And I want to publicly say that I am fighting in Washington to ensure that the president signs the COVID-19 anti-Asian hate bill. We have to come together. And you as healers, you are in fact the pathway of coming together. I earlier said that healthcare, though we all admire it, we all want that healthcare when our loved ones fall sick or we fall sick. Well, let's be honest, there's been a certain mistrust. We've had to work hard in Washington to ensure that healthcare workers were multilingual, that they had a cultural sensitivity, that when they went into neighborhoods, like an East End, like a Sunnyside, like Southwest Houston, they would be able to know the story of those who are there. That's why you're so important. That's why we have to say the words, why we can't wait. But when you're a community health worker, you're folks from the community. You're there to listen. You're there to provide preventative and community-based health care. You create a sense of trust, a sense of belonging. You say to people that you're willing to listen to them. And when you say it's important to be vaccinated, I believe they will listen. We've been working with volunteers, community health workers, the University of Houston community health workers. Thank you for working with us in our vaccine sites. You see the people that are coming in. My motto has always been, be gentle, be strong, but let them know you care. Why we can't wait. Let them know that we can't wait for them to come in and get their vaccination. We can't wait for grandmother and granddad. We can't wait for those who don't speak English, those who are documented and undocumented. We can't wait for humanity. And a community health worker can get more answers than many others. Your mission of being social health architects is something that you should take to heart, because you're dealing with the social fabric of poverty, maybe drug abuse, maybe domestic violence, because you're going into neighborhoods in your profession that I hope will be one where you're spread out throughout the community. I hope you have chosen to go to places where there is definitive need. just as Cheryl Garfield went in that West Philadelphia community and went to the bedridden, the sick. Oh yes, dangerous work. Dangerous work during this COVID-19 pandemic. Don't think that our first responders and you, community health workers, as you graduate, will not be confronting danger. But we are so engaged and so impressed that in this danger, you're still willing to engage, you're still willing to advocate, and you're still willing to seek opportunities for people who cannot find them for themselves. As I did the testing for these 56 testing sites in 2020 and into 2021, when we first began, oh, people were so immensely frightened. People were chilled by the unfortunate circumstances. And I remember times when I had to, not trained as a community health worker, do what you do best. Tap that shoulder, give that comfort, speak to them in the car as they drove through. Our first vaccination or testing site, we literally were taking a person out of the car because they had COVID-19 as they were coming to be tested so that they could be taken to a hospital. There are people who came into hospitals already deadly sick. They needed the comfort of a community health worker. And of course, not only did they need that, but as well, they needed that in their neighborhoods. And so I'm so excited to be able to speak to you about the importance of this work and to be able to cite the words of Dr. Fossey, called America's Doctor. His words are, to see what these brave warriors are doing in the hospitals, not only giving life-saving treatment to people, but every single day putting themselves at risk for themselves and their family. I just think that the American people owe a phenomenal debt of gratitude for the people. They should just salute them in every way. Following up, Rosalind Carter, the First Lady and wife of President Jimmy Carter. There are only 4 kinds of people in the world: those who've been giving caregivers, those who are currently caregivers, those who will be caregivers, and those who need a caregiver. You are, in the broad sense of the word, a caregiver. And you're, in the broad sense of the word, the same brave warriors that were in the hospitals. You are now carrying the story forward. We're not out of the woods for a pandemic and COVID-19. And so this program at the University of Houston, nourishing and growing the strength and infrastructure and the body power of getting people to be unafraid of healthcare, to getting people to seek preventative care, to going to their homes and wondering why grandmother hasn't seen a doctor, pregnant mom hasn't seen a doctor, adolescent has not seen a doctor. I can tell you that it is very important. The numbers show in 2017, the number of suicide attempts by adolescent Hispanic females was 40% higher than that of adolescent non-Hispanic white females. There are many stories to tell. I am so improved because I know you. I have benefited from seeing your work. I'm excited about this graduation, but I'm excited about the program that will build a pyramid that says that America is concerned and interested in healthcare for all of her people. That's what a community health worker can do. You can point to the default and the Achilles heel. You can point to the need, the desperation. You can point to the need for a helping hand. I'm excited about this new attitude that we're not only taking care of people in bricks and mortars and outstanding, beautiful buildings that are hospitals, smaller buildings that are clinics, but we're taking care of people in the neighborhood. We're saying the words, Mi casa es su casa. My house is your house. We're saying, I am your neighbor, I am your brother or sister. We're saying that community health workers will be turned to by doctors and nurses and nurse practitioners to get that guiding post to ensure that we can make a difference. That is why this graduation for me is so much more important than any that we've ever had. It is in the midst of a pandemic, and it is a time when we must make our way. This is a make way time. We must be way makers, and we must be tree shakers. And so my challenge to you today is to recognize the vitality of your profession, to recognize that as we are here today, gathered with your family members, gathered with the leadership of the University of Houston's Community Workers Program. Thank you, Dr. Price, and all of the leadership. As we're gathered here today, there's someone along the highway of life that needs an outreach by a professional trained in the way you are. There's a homeless person that I passed as I came to my office today, rushing to be part of this graduation. There are homeless persons who deserve the dignity of healthcare. You may choose that profession or that direction to go out to be with those individuals who are in fact homeless. That's my passion. I want to see every homeless person housed. I want to see homeless families and children housed. And I want to see a community health worker go right up to their front door or where they are on the streets and be able to give them that helping hand. Remember what I said, why we can't wait. Why we can't wait? Because there are those who are in great need. So let me, as I challenge you this year, 2021, to let you understand that the power in you can be given to empower others. The power in you can be given to empower others. President Obama said, America's nurses, I say America's healthcare workers, are beating heart of our medical system. That's what you are. But my challenge to you, as you make this journey, don't be silent. I want you to be tree shakers and mountain climbers. And I want you to be remembered by the hard work, but the love you show when you meet that desperate person in their home, on the streets, or in a place where you may find them. Tree shakers, mountain climbers, and to be reminded of the words of Dr. Martin Luther King, that when he looked on his last day before his death, and he looked to the mountaintop, and he said these words. He said that he seized the mountaintop, that we might not get there with him, but he knew that we as a people would get there someday. He didn't think he would make it. He didn't think he would see the mountaintop of opportunity. He didn't think he would see the University of Houston's 2021 community health care workers, community workers. He didn't think he would see it, but he knew that we, with our thought processes, with our intellect, with education, would define healthcare and health community workers. The University of Houston Community Health Workers graduating class of 2021. He did not think he might see that, but he knew that there was a mountaintop of opportunity. Why we can't wait. You are in fact close to the angels. Take your challenge, shake the trees, be a tree shaker and a mountain climber. Congratulations to all of you. Congratulations to the wonderment of your family. And I know that on the highways of this great city, on the state of Texas, and on the nation, I will come across a University of Houston community health worker who has found a place in a space that has changed the lives of so many, and in fact, has become that beacon of light and that mountaintop viewer saying, I am here to help. I am a comforter. I'm a healer of your spirit. I will direct you, and we will beat COVID-19. Let's not have vaccination hesitancy. Let's get out there and make it work. Thank you all so very much for having me today. God bless each and every one of you, and God bless the United States of America. Congratulations to you all.
Thank you. Thank you so, so much, Congresswoman Sheila Jackson-Lee. We really, really appreciate your intelligence, your just this way in which you see this situation, the clarity and the force of your vision. We really, really appreciate it. And I'm deeply touched that you've spent the time today to talk to all of the folks and that you recognize how inspiring their work is. Really, really appreciate it and look forward to working together with you throughout the rest of the pandemic and on into the future as we address all of the issues around health disparities in Houston.
Thank you so very much. My best to all of you. Thank you.
And now we'll move on to the presentation of the graduation certificates for everybody who's gotten their certification today. I will be reading the names as they come across. Unfortunately, we can't shake hands, but we will have the opportunity to applaud and to say thank you at the end. Maria Guadalupe Aguilar Martinez. Bahamin Ayla Akhtari. Edith Anaya. Laura Atuesta. Nayeli Avellaneda. Alexandra Best. Kiaria Shante Boudreau. Alma Brown. Nancy Osiris Cabrera. Anna Karen Cantu. Kevin Alexander Chavez. Maria Farfan. Rosa Ferrofino. Kenya Ford. Janet Junette Fryer. Edgar Mora Galvan. Bianca Alyssa Gaitan. Mary Cruz Gonzalez. Minerva Gonzalez. Maybelline Granados. Carlos Alberto Gropa. Kayla Guillen. Jorge Hernandez Valdez. Devonte Hill. Emmanuel Horace. Julia Johnson. Mary Leedy Jordan. Shurya Kashyap. Maria Olivia Lemos Calderon. Taima Lynn Macas. Gabriela Martinez. Delmi Mazariegos. Kintavan McGrew. Althea Menard. Sienna Miller. Ana Montesinos. Rithvik Nair. Chloe Wen. Dr. Lolo Siniere Fidelia Najafor. Cynthia Paola Ochoa Rodriguez. Angel Ola. Maria Adelaida Ortuno. Emilio Lara Osorio. Julissa Palafox. Nicole Perez. Tao Fan. Keisha Pickering. Francia Pilar Piedrahita. Sarah Jane Pinion. Alejandro Quijano Martinez. Stephanie Ramirez. Avery Ratcliffe. Zulema Reyes. Claudia Melissa Romero. Kushbu Shukla. Kayla Silva. Mishona Stedman. Wang Tran. Gilma Moreno Treminio Benitez. Congratulations, felicidades a todos. So proud of all of you. Thanks so very much. Now it's time to turn over to Cindy Paz, who will introduce the Trust Alliance.
Congratulations, everyone, and welcome to the CHW Trust Alliance Red Promotores de Salud. I want to thank everyone for being here today, and again, congratulations on your graduation. With us today, we have the founding members of the Trust Alliance. This network was created for you by your peers, so you can always belong to a supportive network that you can always come back to. Our founding members here today are Jorge Ivan Flores, Michelle Miner, and Cristina Macul. This network was created so you would always be connected to other community health workers in your area. If you have not yet joined, please join the Trust Alliance. You can send an email, and I'll put it in the chat, to the chwi@central.uh.edu. And that way you can always be active in our network. Last but not least, our closing remarks, Dr. Donna Stelsick.
Thank you, Cindy. Thank you, everybody. Thank you, Congresswoman Sheila Jackson-Lee. I love the social health architects, comforters, tree shakers. It was wonderful. And now that we are on our way to better things, I really want to thank also our Dean, Bill Monroe. Thank you so much for helping us and supporting this great program, this great initiative. Thank you, Dr. Price, for making our dreams coming true and giving us the opportunity to gain knowledge through a deserving trust. And thank you, everybody, for loving and serving your communities. You are the ones making the change. Congratulations again to all who are graduating today. I'm very moved. I know we have some things going on in the semester, family members passing away, and still you came through. You're very strong, and you're gonna make change in our communities. Thank you so much. And I am so excited for you. We're gonna be going to our social gathering now. And Ms. Cepeda will share on the chat the link so you can join us there. Thank you again, and thank you so very much, Ms. Jasmine Harris, that she helped us to put this together, and there were so many things behind the scenes. Thank you, everybody, for being here today.
Thank you, everybody. We really appreciate it. Go Cougs.
Go Cougs. And also, para los que hablamos español, nuevamente, muchas gracias. La congresista les llamó diferentes títulos tan conmovedores. Muchas gracias. Y gracias a los que pudieron continuar, aunque el viaje fue difícil, perdiendo miembros de familia y todavía siguieron y terminaron este curso. Gracias a todos y felicidades los que se reúnen. Nos vamos ahora a la reunión social y mi Cepeda ha puesto el enlace en la conversación en el chat. Gracias.
Felicidades a todos. Thank you.
Thank you. Felicidades.